A quick disclaimer before we begin, the PEMF podcast does not contain any medical advice, and the content provided is for informational purposes only. If you have any health concerns, please visit a healthcare professional. Welcome back to another episode of the PEMF podcast.
And today we're going to be talking about PEMF and non-union fractures, which was actually the first ever FDA approved use for PEMF back in 1979. And we're going to be talking about how PEMF can help heal these non-union fractures, the science behind it, some studies, and a little bit more. But for anyone who might not have heard of PEMF, this might be the first episode. What is PEMF, just in a nutshell?
So PEMF therapy, in as simple form as it can be, is basically pulsed electromagnetic fields. So we're using magnetic fields to influence the body's cells, and that in turn will create the ultimate environment within the body to heal.
Okay, great. And for anyone that might not have heard of a non-union fracture, what is that?
So a non-union fracture, in simple terms, is a fracture that is basically one that won't heal or doesn't heal within the expected timeframes. That can lead to pain, inflammation, or the ability to move that joint.
Okay, so how can PEMF then actually help the healing process and help you not have a non-union fracture anymore?
Yes, there's a number of ways in which PEMF therapy can help with non-union fractures, and I'll break these down each individually and try and explain each one. So one of which will be stimulating bone repair, and PEMF therapy promotes the activity of osteoblasts. These are the cells responsible for bone formation. So this is really crucial in terms of healing non-union fractures, and that's when like a fracture occurs, the osteoblast activity is really crucial for initiating the repair and forming the new bone tissue. So in cases of non-union fractures, this whole process is impaired, and that's what PEMF therapy helps to stimulate. On top of that, you've got enhancing blood flow. So you're improving the circulation, just delivers the essential nutrients and oxygen to the area. So that in turn is going to help heal that area. You've also got reducing inflammation, which we talked about a lot on the podcast. And PEMF therapy can help to alleviate inflammation. So that's allowing more of the conductive environment for healing. So that's going to reduce the inflammation, detox the area, and that's also going to help in turn with healing. And the last one probably to mention is bone density. So bone density goes all the way back to the NASA studies and how they were using this type of therapy on their astronauts when using it for bone density. So we'll do another podcast on osteoporosis, and that will go on to a deeper dive into this. So just to summarize that, stimulating bone healing, enhancing blood flow, reducing inflammation, and bone density in terms of like osteoporosis is all going to help with PEMF therapy when it comes to non-union fractures.
And are there any kind of studies into this? Obviously, we know about the FDA approval, but are there any other studies that have been looking into PEMF and non-union bone fractures?
Yeah, so alongside the FDA approval, obviously PEMF therapy and non-union fractures have been linked to this first FDA approval, and there's been many, many, many studies since, but we did find that one that was particularly useful. That included 139 different patients, all of which used the PEMF therapy. Some of them used it less than 3 hours a day, and some of them used it more than 3 hours a day. Over the course of this study, the ones that used it less than 3 hours a day got a 35% success rate of fusing that non-union fracture. And the ones that used it more than 3 hours a day actually got an 80% success rate. This was using a localized device at quite a low intensity, and I think we could get a much higher success rate if we actually applied it at a different modality. But obviously this was just relating to this study. Those same group actually came back 4 years later and had another scan on those non-union fractures, and 92% of them, had maintained a solid union. So obviously after the session of the PEMF therapy for the study, they came back 4 years later and they still had the same success rate. So it was a great little study to pull apart and to look at for non-union fractures and PEMF.
No, definitely. And it aligns with a lot of the stuff that we've said before, obviously about using PEMF consistently over time, and you'll get the results that you're looking for. And obviously this study kind of highlights that. But for people who might not have maybe a non-union fracture or anything maybe wrong with them for their bone health, can PEMF still improve it regardless? Is there people still going to get benefits for their bone health overall just using PEMF?
Yes, there's a massive benefit, and we mention this all the time about preventative maintenance. We kind of talk about PEMF therapy and how modernization has taken us away from the Earth's natural magnetic field, and that can't be any more prevalent here. So it's useful to note when we go back to the NASA studies and when people were going up into space and they were taken away from the natural magnetic field of the Earth, a lot of those astronauts are coming down with lower bone density and osteoporosis problems. And that's the same as what we can show for kind of modernization these days. We're in buildings, we've got shoes on all the time, we're in our cars. We are actually pulled away from the magnetic field almost as bad as like the astronauts would have been up in space. So there are a lot more bone density problems going around in modern society, and PEMF can help, just like going outside and connecting ourselves to the earth. But obviously a lot of us can't do that with the conditions and weather we live in. So PEMF can act as a really good preventative maintenance for bone density problems. The other side of the coin here is strengthening bones. So if you want to prevent injury, so when we're talking like this, it's more about athletes and people that are training at the absolute top of their game. And they're putting their bodies under a huge amount of stress. Obviously, if we can keep our bone density to a maximum ability for these sorts of individuals, that's in turn going to help reduce injuries.
No, definitely. And for people looking to maybe heal a non-union fracture, what is the best way to apply that? We said about in the study that they used localized application. Would that be kind of the general rule? Or
So yeah, this is a great question, because a lot of the time a non-union fracture will be located to one area of the body. And we stress this in our other podcasts. For me, the basic principles of PEMF, I always want to go down the full body route, even if you're going to localize it in one area. So you are going to get results. Let's give you an example. If you've got a non-union fracture on your arm, you can apply a device locally to that area and expect results over a period of time. And it's just like the study that we mentioned, and that also will have results. But if you want to accelerate those benefits, and if you want to accelerate that healing process, for me, I would always say use a full body mat. And then if you have one, use the localized applicator in that area. So some of the systems offer full body and localized in one system. They're the sorts of devices I would say to aim for. If you don't have the budget and you just want to go for a lower intensity localized applicator, then as I say, you can apply it to the area. You will get results, but it might just take a little bit longer to get the results that way.
And talking about how long should someone apply it for, and how often? Is it the same kind of general rule that we normally say, or is it slightly different?
So when you're talking about non-union fracture, you're talking about a fracture that's been there for maybe even years, or is just not healing over the time frame it should be. And this could be in sports, they want to accelerate the healing time. It could just be in general that your bones are not strong enough to heal that fracture. When we put it into time frames, bones won't heal overnight. Even the best performing bodies won't heal overnight, So this is one that people do have to expect some kind of time and some kind of commitment to a system. But if we think about a break, and, the best kind of breaks will sort of heal in a number of weeks to months, that's what we want to be aiming for with a non-union fracture. We want to be healing that within a normal time that a fracture would take.
And for people as well who might have a cast or maybe like bandages around where their fracture is this going to change how they should apply it, or is there any difference?
Yes, the beauty of PEMF therapy is, like we say before, you don't have to derobe to use PEMF therapy because it will work through clothes. Exactly the same, it will work through casts. So the good thing about that is that if you have a non-union fracture and it's in a cast, or it's got a lot of bandages around the arm or the shoulder or wherever that non-union fracture is, you can still apply PEMF therapy, and that's a great application for this. When you get other therapies like red light, laser therapy, all these sorts of things that also can help with non-union fractures, you have to actually see the skin. You have to see the site that you're treating. But like I say, with PEMF therapy, it will go through all these layers. You may want to then consider a higher intensity device, because with the higher intensity becomes a larger magnetic field. And what I mean by that is anything above, what we would consider as a low intensity device will be about 10 Gauss and below. Something above that will have a much higher or a much larger treatment range, and you should be able to penetrate through the body, through the cast, and treat that area without having to manipulate anything.
Okay, great. And if you're listening now and you've got any other questions about PEMF or non-union bovine fractures, make sure to leave them below or wherever you're listening from, and we'll get around to answering them. And if you want to see the study that we actually mentioned in this episode, go check out our Instagram. It's on there somewhere. It might be a little bit further down now, but there's loads of other PEMF studies and loads of other PEMF related content, which you'll probably find useful. And if you're listening on any other audio platforms, make sure to leave us a 5-star review. It just helps us make more episodes and get better guests on.
Thanks for listening to another episode of the PEMF podcast.